CPR guidelines define the most effective way to perform CPR. Yet there is a gap in quality between recommended guidelines and actual performance by most providers. In most cases, we are not performing CPR as well as we can. High-performance CPR is a simple concept.
Nice bust, Terry.
Improve the performance of CPR through high-quality skills, along with a practiced team approach, and the chance for survival improves. With the development of high-performance CPR concepts and more clearly defined high-quality skills, the effective delivery of a high-performance approach is becoming more widespread through EMS organizations in the U.S. and around the world. Many of these same concepts and skills can be applied by pre-EMS providers in workplaces, medical and dental offices, skilled care facilities, pools and beaches, law enforcement, and corrections. Sudden cardiac arrest, which mostly affects adults, occurs when the normal electrical impulses in the heart suddenly become disorganized. Normal mechanical contraction of the heart is lost, and in the vast majority of cases, a chaotic, quivering condition known as ventricular fibrillation occurs. Blood flow, along with the oxygen it carries, abruptly stops. Within minutes, brain cell death starts to occur. Cardiopulmonary resuscitation, or CPR, is the immediate treatment for sudden cardiac arrest. Without CPR, it is unlikely a person in arrest will survive. CPR artificially creates blood flow in the body through compression of the chest. Combined with blowing oxygen-containing air into the lungs with rescue breaths, CPR can provide limited oxygen to body organs. When ventricular fibrillation occurs, CPR does not restart the normal electrical impulses of the heart. That is accomplished by defibrillation, a controlled electrical shock sent through the heart that can stop ventricular fibrillation and allow the heart's normal electrical and mechanical activity to return. An automated external defibrillator, or AED, is a simple-to-use, portable, computerized device that can deliver this needed shock. What CPR does do is improve the chance that defibrillation will work by providing some circulation of blood and oxygen to body tissues and heart muscle, buying time for the next level of care. Overall, it is important to understand that survival from sudden cardiac arrest can be influenced by the quality of the CPR provided. How can you do better? High-performance CPR starts with a focus on high-quality chest compressions and rescue breaths. Compression of the chest is best accomplished by compressing the lower part of the breastbone. This increases pressure within the chest and compresses the heart, forcing blood in the heart, lungs, and large blood vessels out into the rest of the body. Blood flow created by chest compressions is limited when compared to normal blood flow. Poor compression quality limits this even more. Breathing is normally accomplished through the action of the diaphragm and chest muscles, which create a suction when the chest expands, pulling outside air into the chest. When breathing stops, air can be forced into the lungs by blowing it in through the nose and mouth. There is enough oxygen in your exhaled air to sustain the person you are giving rescue breaths to. There are 5 basic measures of high-quality CPR skills: chest compression rate, chest compression depth, chest recoil between compressions, interruptions to chest compressions, and the volume of air in rescue breaths. Studies have shown survival from sudden cardiac arrest improves as chest compression rates increase until about 120 compressions per minute, when it starts to decrease. Peak survival occurs at around 100 to 120 compressions per minute, the optimal rate for chest compressions. Studies also clearly show that the deeper the chest compression, the higher the survival rate. Compressions of at least 2 inches are recommended to maximize compression quality. Minor injury can occur with deeper compressions, but that should not prevent a provider from getting the maximum depth possible. It is common for a chest injury to occur, even from proper technique. Full chest recoil during compressions is when the chest is allowed to return to its normal position on the upstroke of each compression. Blood flow into and out of the chest and heart is accomplished by the movement of blood from areas of higher pressure to areas of lower pressure. Allowing the chest to fully expand between compressions creates a bigger gap between those pressures and allows for greater blood flow. The effect of recoil on blood flow and survival from sudden cardiac arrest is significant and should not be underestimated. Blood pressure is created and maintained with ongoing compressions. When compressions stop, pressure is quickly lost and has to slowly be built up again. Even a short pause results in a significant period of reduced blood flow. There are necessary pauses during CPR to provide rescue breaths, defibrillate, and switch places. Unintended interruptions, especially when providers are not prepared, occur as well. Chest compression fraction is the calculated percentage of time chest compressions are being performed in relation to the overall time of performing CPR. It is critical to minimize any interruptions to the chest compressions during CPR. Achieving a chest compression fraction, or CCF, of greater than 80%, meaning compressions are being done at least 80% of the time, is recommended in high-performance CPR. It is estimated that a 10% improvement in chest compression fraction can result in about an 11% increase in survival. The greatest concern in providing rescue breaths is providing too much air. Excessive air volume forced into a person's stomach can result in complications that reduce the quality of your effort. Rescue breaths need to last only 1 second and create just enough chest rise to indicate that the breath is effective. Additional air is unnecessary. When giving more than one rescue breath at a time, it is important to prevent breaths from stacking. Remove your mouth from the port on a CPR mask between breaths. Overall, it is normal for there to be a gap between high-quality CPR skills and what you can actually perform. Your goal in high-performance CPR is to narrow that gap as much as possible.